Some hospitals in central New York already postponing elective surgeries, though, before Governor Hochul's executive order.
OSWEGO Health Chief Medical Officer Dr. Duane Tull joins us now to give us more information on how their hospital is doing. Thanks so much for joining us tonight, Doctor.
Thank you.
So, Dr. Tull, OSWEGO Health is right at that 10% threshold of vacant beds that the governor has set. But you paused electives weeks ago. So would any of that executive order actually affect you directly? And if so, how?
Yeah, actually, the executive order hasn't really changed anything for us. We started limiting to urgent and emergent cases several weeks ago due to staffing and a high patient census. So it's a status quo for us at the moment.
Okay.
Status quo. Maybe just a little explanation for viewers listening tonight about the term elective surgeries. It's been used a lot during this pandemic. What are they? What are they not?
Yeah, most every surgery that we plan is considered an elective surgery. It means that it's not done as an emergency, it doesn't involve life or limb, and it's not going to change the person's survivability. You know, most hernias can be done electively, most gallbladders, most any of our surgeries can be done as an elective. It just means that it doesn't have to be done right this second.
So that's a pretty big umbrella of things that that you do or don't do now. Right. What kind of impact of not being able to do these kinds of procedures in your system, for your medical staff and the patients, obviously, who have to wait now?
Well, of course, both the medical staff and the patients are a little bit frustrated by the limitations we have. I mean, surgeons, the reason people are surgeons is they want to do surgery and help people. Mm-hmm. We're very proud of them. Everybody, including the patients, have been very cooperative with working with us in the limitations. And hopefully we can see staffing improve and we can move beyond this.
And right now the hospital has 60 beds that it can staff, 20 filled with COVID patients, another 34 non-COVID patients. Could you maybe share with us the atmosphere inside the hospital? What is it like inside right now?
The atmosphere, believe it or not, is actually very positive. When we do have the COVID patients that do poorly, that of course affects everyone. But our nurses are stepping up. We are working on getting traveler nurses as well as hiring new nurses to try and take the pressure off. We've actually brought in some mid-level providers to even help with that.
But clearly you're stretched pretty thin. Are there situations where patients have to be taken to other hospitals for care? How far away do they have to go? Especially, obviously the Syracuse hospitals seem to be pretty full too, so that might not be an obvious option right now.
Yeah, being a small community hospital, we have various restrictions on what we can do. We don't have nephrology services, we don't have neurosurgery, we don't have cardiac services. So as a result, we end up having to transfer some patients to higher levels of care. Our primary market for transfers is Syracuse, but with them being on diversion many of the times, we have transferred as far as Westchester, Albany, and Cooperstown.
Wow. So it is having an impact. And I know you've had staffing meetings preparing for the weeks ahead. As we go indoors, new variant out there, Delta's still very much around, and now we've got the flu circulating again. What are you getting ready for?
Well, we're trying to gear up and be prepared. We actually have a medical staff meeting tomorrow night, and that's one of the topics on the agenda. The anticipation with this new flu season is that it may be a hard flu season with many hospitalizations. You add that to the continued COVID, the possible surge after the holidays. We're working on getting new staff in here and trying to support our existing staff.
Dr. Tull, maybe time for one last one for you here. Do you have a message to the community, your community, maybe the community at large that are watching us, wherever their healthcare system is, about how they can help ease the pressure on the healthcare systems?
Well, to the residents of Oswego County and those that use our services, we want you to know that we will do everything we can to take care of everyone that we need to. To everyone in general, my recommendation is let's prepare. If you haven't gotten the COVID or flu vaccine, consider getting them. Remember to continue your hand washing, your social distancing, and be prepared. This could be a difficult winter.
Important message. Thank you, Doctor, for joining us tonight from OSWEGO Health. He's the Chief Medical Director. We appreciate your time.
Thank you.